Hello everybody, Miss King here, and I am just going to talk to you a little bit about how your heart and peripheral vascular lab for health assessment is going to go on Tuesday. So the very first thing that you're going to want to do is go to D2L, go to the video and lab module, and then go and find your heart and peripheral vascular system checkoff sheet. You're going to want access to this sheet when you come to lab, and it needs to be printed. That way you can utilize it while you are practicing with your partner, but also you can give it to whoever is going to be doing your checkoff so they can watch and check off and adequately mark it as you are going through your assessment. So once you print this off, have a good look over it. This is going to be your instructions. Later in this video, I'm going to walk you through step by step of everything that you need to do and how to do each of these assessment techniques. When we get to lab, whether you're in the morning or in the afternoon, the first little bit is going to be spent allowing you guys time to practice with your partner. If you want to practice a little bit before you come to lab on a friend or a family member, that's encouraged and supported as well. But you'll definitely want to practice for a little bit with your partner because everyone's pulses and anatomy is going to be just a little bit different. So you probably will want some practice time with them as well. So once you and your partner feel ready to check off, then you will come and find me or our lab assist. On Tuesday, it is going to be Miss Hutchinson, and we will all go into a private location, one of the hospital beds where we can pull the curtains around it. Whoever is going to be the patient first will go ahead and change into their shorts and either a sports bra or a tight-fitting shirt or tank top for females, and either a bare chest or a tight-fitting tank top or t-shirt for our male students. Whoever is the nurse first will hand me or the lab assist their printed check sheet, and you will complete this assessment from memory. Yes, it has to be from memory, so you will want to look over it a little bit before. You will have opportunity prior to checking off to ask any questions. We'll be around to give you feedback, so you should feel pretty comfortable going into this checkoff. When you look at this checklist, and I'm going to pull it up on the screen right now, you'll see that there is a list of assessment techniques that you need to hit, and there'll be a satisfactory or needs practice. If you hit each of these sections correctly, we'll do a satisfactory check, and if you did not do it correctly or if you forgot it, we'll hit needs practice. This is a pass or fail assignment, so you only have to make a 75%. So as long as you try your best, get through everything, and adequately and safely perform your assessment techniques, you should be good. You will get 100% marking for the day. If there's a question on whether you hit everything right or a question about if you performed everything correctly or safely, then we will average out the sections that are missed. And if it's less than 75%, then you will have a chance to repeat. So don't let this be too scary for you. It does need to be taken seriously, but there are ample opportunities to practice, to get feedback, and we're not just going to automatically fail you if you, I always say, have a brain fart and forget. So with every procedure, the very first thing that we're going to do is introduce ourselves to our patient and tell them why we are there. It's as simple as, hi, my name's Stacy. I'm going to be your student nurse today. I'm going to be performing a cardiac and peripheral vascular assessment, if that's okay with you. It should take about 10 minutes, and then we will get you going with your day. Next, we are going to provide for privacy, wash our hands, check our patient's identification. So we just say, can you tell us your name and your birthday? And check that with their armband. We won't have armbands on, but we'll pretend for the day. After completing all of our safety, we will raise our bed to our working height, ensure adequate lighting, and then we can begin our assessment. If you look, our very first section on our assessment is a health history. There are 10 questions on this. I do not expect you to have them all memorized. What I want you to do is pick 3 health history questions to ask your patient and have those 3 memorized. So you can pick any of those 10, but you do need to ask 3 questions. Do you have any chest pain or tightness?
No.
Do you have any swelling in your feet, ankles, legs, or arms?
No.
Do you use tobacco products?
No.
The first thing that we're going to do for our actual hands-on assessment is inspect the skin color of the precordium, our patient's overall skin color, and the color of their nail beds. The first thing I'm going to do is just look at the skin of his chest, look at his overall skin color on his extremities, and I notice it's nice and pink. It's appropriate for his ethnicity. I'm going to look at the color in his nail beds, and again, it is nice and pink. Next, we move on to inspecting for jugular vein distension. Remember, this can sometimes be seen in patients, but that should disappear once you get to about a 45-degree angle. So to assess this, we are going to have our patient get to that 45-degree angle, whether they need to get up on their forearms and kind of raise themselves up, which we'd have to be careful about doing this in the clinical setting to ensure our patient could. But in the clinical setting, we can always raise our bed. I'm pretty sure in the Duncan lab, we'll be in normal hospital beds. So you'll just put that hospital bed to about 45 degrees and then have them turn their neck to each side and look to see if we see that jugular vein distension. And we're just going to simply state no jugular vein distension noted. If there was, then we would put that in our nursing notes and possibly assume that we might have a little bit of heart failure going on. Next, we're going to check for capillary refill. So we need to do this in all 4 extremities. So on each of the extremities, right hand, right foot, left foot, we're going to squeeze a nail bed. We can pick any nail bed on that extremity and assess for capillary refill. Remember, we want it to be less than 3 seconds. We want that color return in less than 3 seconds. So as you're going through your assessment, you'll just say, I'm checking capillary refill in the right hand, checking capillary refill in the left hand, and so on. And then you can say capillary refill in all 4 extremities was less than 3 seconds. Next, we're going to move on to pulses. So we're going to start with the carotid pulses in the neck. Remember that we assess these one at a time. We never, ever want to assess the carotid pulses at the same time because we can cut off blood flow to the brain. So one at a time, we'll check the carotid pulses, and then we are going to note how strong they are. Remember, the normal finding is 2+. So after we check those carotid pulses, you'll tell us, you'll look at us and say, the carotid pulses were 2+ bilaterally. Next, we will move on to the brachial pulses, which are near the elbows. And when we do the brachial pulses, we will do both of these at the same time. This may require some finagling with your hands or moving to some different positions, but they do need to be assessed at the same time so we can compare them back and forth to each other. Again, once you have found the brachial pulses, you'll tell us the brachial pulses were 2+ bilaterally. Next, we will move on to the radial pulses at the wrist. And again, we will check these at the same time. And you will look at us and say the radial pulses were 2+ bilaterally. Next, we will move on to the lower extremity pulses, and we will assess the posterior tibialis, which is near the anterior ankle, and we will assess the dorsalis pedis, which is on the top of the foot. Again, both of these need to be assessed at the same time, and you will tell us what your findings are. It can be common, 2+ we know is our normal, but it can be common for pulses to be lower in the feet. So if you only find a 1+ finding when you rank these pulses, that is perfectly okay, and it can be an expected finding. It should just be equal and bilateral on both sides. These pulses can be a lot harder to find on the lower extremities as compared to the upper extremities. So these are a few that if you do have someone living with you that it would be good to practice on prior to coming to lab, just getting used to finding them. One of my hints for finding the dorsalis pedis on the foot is to start in between the big toe and the second toe, and then work your way up. It's a very, very light touch, because if you push too hard, you can actually occlude and not feel it. So light touch, work your way up the foot until you find it. Now I am going to check his pulses. So the first one that I'm going to do is the carotid. And remember, we do the carotids one at a time. So can you hunch your neck less, please? Just relax. And then I'm going to check the other side. Carotid pulse was 2+ bilaterally. Now I'm going to move on to the brachial pulses. Can you put your arms just like that, sir? Mm-hmm. And it helps to find one first and then the other. Brachial pulses were 2+ bilaterally. Now I'm going to move on to the radial. And remember, these are just in line with the thumb. So I'm going to find one. Then I'm going to find the other. 2+ bilaterally. Now I'm going to move on to the posterior tibialis. And the other. Posterior tibialis is 2+ bilaterally. And then I'm going to move on to his dorsalis pedis. I was saying, find the space between his big toe and his second toe, and then start working your way down until you can find it. And you just want to do a really light touch. Okay, I can find his. His are actually 2+. So then I can find the same location on the second one. Dorsalis pedis is 2+ bilaterally. Now we are going to move on to the exciting part, the auscultation of heart sounds. So when we auscultate, you're actually going to be listening twice. The first time, you will be listening with your diaphragm for heart sounds. The second time, we will be listening with the bell of the stethoscope for murmurs. Before I show you the assessment on Easton, I am going to insert a graphic right here, and we are going to review exactly where you are going to find each location for each heart sound. So first, we will listen at the aortic point, which is on the right sternal border, second intercostal space. Next, we'll move on to the pulmonic, which is the left sternal border, second intercostal space. Then we'll move down to Erbs, which is the left sternal border, third intercostal space. Moving down, tricuspid, left sternal border, fourth intercostal space. And then fifth, which is mitral, which is the fifth intercostal space, midclavicular line. So putting it all together, I'm going to walk you through exactly how I want you to demonstrate to us the auscultation of heart sounds. The first thing I'm going to do is twist my stethoscope, make sure that the diaphragm side is on, and then warm it up for my patient. I've already cleaned it prior to doing my assessment. I'm going to start at the aortic location, which is in the second intercostal space. I'm going to work my fingers down on the right sternal border. Regular rate and rhythm. Then I'm going to move on to pulmonic, which is on the left sternal border, second intercostal space. Regular rate and rhythm. Then I'm going to move down to Erbs point, which is the third intercostal space, left sternal border. Then I'm going to move down to the tricuspid, which is the fourth intercostal space, left sternal border. Regular rate and rhythm. Then I am going to move on to the mitral, which is the fifth intercostal space, but this time it is midclavicular line. Regular rate and rhythm. And while I'm here, I'm going to go ahead and take my apical pulse. So I'm going to count his pulse for a full minute. We'll pretend that a full minute has passed. His pulse was 88. Now I'm going to twist over to the bell side of the stethoscope and repeat the process. After you've gone through with the diaphragm, listening for heart sounds, we are going to repeat the whole process again. However, the second time, you do not have to tell us where the exact location is. You just have to say the name of the location. Now I'm going to twist my stethoscope so that the bell is on, and I'm going to listen to every location again. You only have to tell us the name when you go through it the second time. You don't have to say exactly how to find it. So I will demonstrate. Aortic, no murmurs present. Pulmonic, no murmurs present. Erb's point, no murmurs present. Tricuspid, no murmurs present. Mitral, no murmurs present. Next, we're going to move on to assessing the peripheral vascular system. And this can be a little bit repetitive, and I'm going to talk to you about combining the assessment techniques at the end of this video. But just to go through each step, again, to assess the peripheral vascular system, we're going to assess the color of the extremities. We are going to assess the color of the fingers and the toes and the nail beds, and we're going to look for any ulcerations on the legs. Next, we're going to assess for skin temperature. Remember, you use the back of your hands and you do it on the upper extremities at the same time, and you do them in the lower extremities at the same time. And then you can tell us the normal finding or the expected finding would be skin color is pink, tan, dark brown, appropriate for ethnicity. Skin temperature is warm and dry. So again, the color in his extremities are pink, appropriate for ethnicity. The color in his nail beds on all four extremities are pink, appropriate for ethnicity. He has no ulcerations on his legs. And I'm going to look on the top, on the feet, and then remember to look underneath as well, because we want to look under the heels and on the back. So I want to look everywhere. No ulcerations. I'm going to check his temperature using the dorsal side of my hands at the same time. Temperature in the upper extremities is warm and dry. Temperature in the lower extremities is warm and dry. Next, we're going to ask our patients if they had any numbness or tingling in their extremities. And then after that, we are going to assess for edema. We are going to assess in all four extremities, and you do that by just using your pointer finger to push into their skin. The expected findings should be no edema noted, but if there is, then you will need to grade it using the chart that we talk about in our lecture. Last but not least, we are going to assess for edema in all four extremities. So just take your pointer finger, and we're just going to press in and see if any indentations are left. I'm going to check on his ankles. Any tingling or numbness in your extremities?
Nope.
No edema. No edema is present. To end our assessment, we're gonna lower our bed, make sure the wheels are locked, side rails up, call light and reach, do all of our safety procedures, make sure our patient is nice and comfortable, thank them for letting us provide care for them for the day, and then wash our hands on the way out. As you can see, some of this assessment could be in a little bit of a different format, or you can see ways that to make this easier and more time efficient, that you could combine certain elements, and that is perfectly okay. We have checked off many of people and we know what to expect. We know what you're supposed to be doing. So if you want to go in a little bit different order, that is completely up to you. An example of that might be someone might ask all their health history questions and then let us know that they are going to start with inspecting the extremities. And instead of jumping around, sorry, that's my dog. I know you guys love puppers, so I'll give you a little. There's Scout. Hey, Scout. getting back to the assessment, an example of this might be some people might want to include everything on the extremities all together. So they may check skin color, skin temperature, capillary refill, all the pulses, moisture, swelling, all of that together, and then end with auscultation. If you want to put this together in a different way that makes better sense and a better flow for you, you are more than welcome to. If you want to go step by step down the checklist to make yourself feel better and know you're hitting everything, that is perfectly fine as well.